middle of last week. And so, as Laurel has said, that we've now begun to sort of enter into this cycle of sort of, more regular shipments coming to individual providers, pharmacies, and other entities. And again, to stress, for Anchorage in particular, as Laurel alluded to, we continue to have a strong focus on the administration of vaccine for school children. And so today actually marks the beginning of sort of a second phase for the school district to make vaccine available for school children over this next sort of 3-week period. At the end of that 3-week period, then they will have made vaccine available to all Anchorage School District students whose families chose to accept it. So they're getting through their campaign as well.
And is the city going to have any clinics? I know there were still a couple still on the schedule for UAA and Clark Middle School.
You betcha. We continue. We're sort of in an ongoing process of evaluating the availability of public vaccination clinics for Anchorage. We have several scheduled in the month of December, and we are also continuing to make plans to schedule public clinics into the month of January as well. Of course, all of this continues to be driven almost exclusively by the actual real availability of vaccine and the types of vaccine that actually come into the door for us. And so we've done, over these past several weeks, I think the media has seen and the community has seen, several changes to those the clinic schedules as they've evolved. And we anticipate actually to do an update of our December schedule tomorrow in light of this new information coming and the state's ability to be able to loosen up the restrictions and to make the vaccine more broadly available. And with respect to our public vaccination clinics, I think that will give us more flexibility and the ability to get the vaccine out to a broader audience, if you will. So we continue to modify that schedule, and we'll have several events available in the month of December.
Thank you, Jason.
Yep.
Anything else from the phone?
I was just wondering, so does that mean that the mass vaccination clinics that are going to be held around Alaska, are they going to continue to be updated now with this new information and then be extended to all Alaskans rather than just priority groups?
Beginning tomorrow, any clinic anywhere that has the vaccine available, including at a public clinic, will be able to use that vaccine for people beyond the priority groups. So we will be working with our public health nurses and public health centers around the state to make sure that we provide them with as much vaccine as possible. Again, even though we are making this announcement today, this isn't to say that we have absolutely received enough vaccine for everyone to be able to get vaccine tomorrow. It's just absolutely critical, though, that we don't have vaccine go to waste and have it still sitting in refrigerators months from now when it could have been used to protect Alaskans. So it's a little bit of a balancing act to determine exactly when is the right point to make this move. We have had vaccine available now at some quantity levels for the last 2 months, have continually emphasized the importance of vaccination of priority groups. So have we reached everyone in the priority population? No, but have we had vaccine available for 2 months to try to reach as many of those as possible? Yes. And so again, the balancing act is when is the appropriate time so that we also can protect some of those people in priority groups by protecting the people around them to keep them from transmitting influenza to other people. So the balancing act is that we felt that we have tipped the scales to the point where it's time to go ahead so that we don't end up with vaccine still sitting in refrigerators in June, which we have had happen in the past when we have had vaccine shortages. And we have perhaps waited longer than certainly we are today. And we've ended up having vaccine go to waste. And it's our goal to make sure that doesn't happen this year and that we protect as many Alaskans as possible. Having said that, I would like to add one thing. It's important to recognize that the municipality of Anchorage is receiving their fair share of the vaccine available for the whole state, and that the vaccine that they are using in the schools is not any greater allocation than would be available to them for their size of the population. And the reason I want to emphasize that is because it's also critically important to us to make sure that vaccine is available in rural locations around the state too. And we continue to work with the Alaska Native Tribal Health Consortium and our other rural partners to make sure that vaccine is available on a population basis around the state.
Are there any areas of the state where the providers say they are saturated, or is it just scattered locations here and there?
It's not areas that are saturated as much as we are beginning to hear from providers, that some of whom are saying, do not send me any more vaccine. I don't have anyone wanting to receive it anymore. And so it's more a provider basis than a community basis at this time.
And are doctors' offices and nurse practitioners, are they still signing up, or if they haven't signed up already, they aren't signing up now?
We are still allowing people to sign up, but to receive the vaccine, providers rather, to receive the vaccine. We have certainly seen those numbers dwindle in the last few weeks. I think in the last couple of weeks we probably only added 3 new providers. But we will accept additional providers if the need is there.
But you've got 300.
We have over 350 locations that we've been shipping to. So, and it's been widely publicized about the availability of this program. So I believe that most Alaska providers who were interested in receiving the vaccine at their clinics have already signed up to the program.
Is it tilted towards people who serve pregnant women and people who serve children?
I'm sorry, I didn't get the beginning of your question.
I wondered if the...
Go ahead, Rosemary.
Okay, I just wondered if the providers are on balance more towards
pediatricians,
pregnant women and those who serve children.
Well, certainly we have all types of providers, but as one would expect, we have many providers signed up who are reaching the priority populations. So many pediatricians, many OBGYNs. In more rural parts of the states where there aren't OBGYNs available, we may have more family practice physicians and others who might be dealing with women who are pregnant. But we pretty much have a wide variety of types of providers, including internal medicine specialists who might be seeing people with chronic health conditions. So it's pretty much across the board.
Dr. McLaughlin talked about the possibility of a third wave. When was the first and second waves?
So the first wave occurred this spring, and then we saw a fairly marked decline in the incidence of disease during the summer months, and then the second wave started in the fall, pretty much coinciding with school. I think the real important thing for the general public to be aware of here is that although we are starting to see a decline in incidence of disease both nationally and in Alaska, it's impossible to say what's going to happen tomorrow. The incidence could increase again, could increase very rapidly. We could continue to see a decline in incidence and then a third wave. We know that from past pandemics that have occurred, a third wave has occurred. For example, the 1918 influenza pandemic had 3 distinct waves. The other thing that's important to note is seasonal influenza may start to take hold nationally and in Alaska. It typically does around this time of year, and we usually in Alaska see a peak in seasonal influenza activity in February. So we are certainly not out of the woods yet.
And what about the decision to open it up to everyone? How does that compare with what other states are doing now? Is the CDC influencing that at all?
No, CDC is not telling states that they should open up influenza vaccine to all residents of the state. There are several other states nationally who have done this already, but we are probably one of, I don't know, Floral, if you have any numbers.
Other than Oklahoma being the first, I don't know how many.
We know that Oklahoma was the first, so.